I'm very pleased to formally open our conference. I'm very pleased to introduce this video from the Minister for Health, Stephen Donnelly. The Minister and his department have played an absolutely key role, especially in the last year or two, in advancing a number of recent developments in personalised medicine. So I'm really looking forward now to hearing about his ambition in this area.
It's my great pleasure to welcome you today to the Health Research Board's annual conference. I'm sorry that I can't be with you there in person. The HRB plays a vital role in contributing to our national research landscape. I'm very much committed to supporting the ongoing work of the HRB. This year's conference theme, which is Personalised Medicine, is both timely and topical, as we've made very important advances in this area recently. Personalised medicine, of course, is about working towards care where individuals are at the centre of the treatment that they receive. It can only be achieved when patients are contributing to the design, the implementation, and the evaluation of the services. And for this reason, I want to thank all of the patient representatives participating in the conference today. It's fantastic. In particular, I'd like to acknowledge the work of Orla Tinsley and Robert Joyce. Orla and Robert are two patient representatives who've played such an important role in helping to deliver today's conference. Personalised medicine, of course, represents a very exciting opportunity, an opportunity to improve the future of individualised healthcare and ultimately greatly improve outcomes for patients. It holds a lot of promise for disease treatment and, of course, for prevention. While there are high expectations for this service, there are also a lot of important questions that we have to consider. What are the social and ethical implications of personalised medicine for healthcare systems and for the different stakeholders? How will we measure the benefits of personalised medicine? First and foremost for citizens, for patients, and of course for the healthcare system as well. Today's conference is going to provide a very welcome opportunity to hear views from a lot of different people, from policymakers, clinicians, researchers, patients, industry, regulators, and citizens addressing some of these really important questions. My department is committed to prioritising personalised medicine in the overall research agenda. I'm committed to it, and the government is committed to it. To help draw attention to this and other research areas, we've developed our first Statement of Research Priorities. The statement is designed to highlight the government's immediate policy-driven research needs. To support this, the HRB is going to launch a Research for Policy call for proposals linked to the statement. This is going to happen next year, and I would like to encourage all researchers here today to take a look and to consider applying to this call. One of the most significant advances in Ireland connected to personalised medicine is the development of a national genetics and genomics strategy. This strategy is going to be launched very soon, launched on the 13th of December. It's going to provide an absolutely essential strategic direction to our work in the years ahead. I was delighted to announce nearly €3 million in funding next year to support the implementation of this work. I very much look forward to seeing the establishment of the National Office for Genetics and Genomics and to seeing the appointment of a national director to implement the strategy. In our pursuit of personalised medicine, there are lessons that can and of course must be drawn from international experience. Irish involvement in 3 initiatives are worth a quick mention. Firstly, HRB representation on the International Consortium for Personalised Medicine. Secondly, the Irish application for entry into Horizon Europe Partnership on Personalised Medicine. And thirdly, Irish membership in the European 1+ million genomes, or 1+MG initiative. Under the 1+MG initiative, the HRB has secured Irish involvement into the recently launched Genomic Data Infrastructure project, which is fantastic to see. This initiative is going to establish a federated European genomic database. The advance is going to enhance data-driven research and personalised medicine solutions for patients. Of course, high-quality data is essential for personalised medicine. Its collection and its use require a very safe and a very trusted environment for personal data. The principle was affirmed in the recent citizens' jury held by the Irish Platform for Patient Organisations, Science and Industry. results from the jury affirm the public's very serious desire to ensure that their personal data is protected. Earlier this year, to that end, I received Cabinet approval to develop the general scheme of the Health Information Bill. This bill is going to enhance our overall national data infrastructure and provide a much stronger framework for Irish personalised medicine provision. This is, without a doubt, a very exciting time to be working on personalised medicine. I'm very much looking forward to hearing about the results of your work today and of your conference today. In closing then, I wish once again to thank the HRB for organising the event. In particular, I'd like to thank Dr. Mairead O'Driscoll, HRB CEO, and Mairead for your strategic role in providing the strategic leadership that's required to deliver on what are very important ambitions that we all have. I'd also like to thank the many members of the board, of the HRB board, of the chair of the board, Professor Bernie Hannigan. Bernie, thank you very much. Your efforts, the board's efforts in supporting the work at HRB can be seen right across the board. It can be seen in the success of today's event and the overall impact that the HRB is having. So can I wish you all the very best in your ongoing work and for your conference today. Thank you.